Training is now underway for roughly 200 traveling nurses who began deploying to hospitals across both metro and rural Minnesota this week. The state-led effort is generating praise from hospitals that have seen staffing become even more dire amid the Omicron surge. But new details about the state contract is also raising a few eyebrows among frontline workers. Alina has now begun training what will eventually be about 40 traveling nurses to help supplement their short-staffed hospitals for the next 60 days.
We're very grateful, and we feel like the community and the state has heard us, and it helps us care for more patients.
But Chief Nurse Carol Keppel-Olson says the stress on the system is so great that the added help will likely only make a dent.
Abbott Northwestern has opened almost 75 beds in the last year that weren't previously opened, and we need nurses to staff those.
Do you believe that this will make a meaningful difference in that?
It's a start. It's a help. I definitely we'll take every help we can get. Our staff has been amazing for the past 2 years. They continue to show up and deliver awesome care, all of our healthcare workers across the state. And this just helps them feel heard. It helps them feel more motivated. And it gives them a little relief.
But some of those workers disagree.
It's a bitter pill to swallow.
As an ICU nurse and president of the Minnesota Nurses Association, Mary Turner says that bitter pill is the state's $40 million contract, first reported by the Pioneer Press, which will pay traveling registered nurses $275 per hour and higher, which is 5 to 6 times the rate of most Minnesota nurses.
I am very aware of how desperate our nurses are at the bedside. I want to be very clear that any help that we're getting from the state and federal, from anywhere, is appreciated. That being said, I have to be honest that my phone has been ringing off the hook today with nurses that are a little bit upset once again that their loyalty at our hospitals is not being acknowledged or rewarded.
Turner says many are upset because they're still waiting for state lawmakers to agree on a proposed frontline worker bonus. But the Minnesota Hospital Association says there's little other choice. A survey found more than 1,800 open nursing positions currently across the state.
And it's not fun to start a shift in an ICU with only 2 nurses when you need 7. We are desperate, but that doesn't mean that we don't want to be respected for the work that we have been doing.
In a statement, the Minnesota Hospital Association said they're working with the governor and state legislators to develop policies and funding to help recruit and train more healthcare staff, but added there is a long way to go.